Tell me what brings you in today.
Hello, everyone. I'm Patrick, and I have had some hand pain for a long time after building a rock wall using cobblestones to knock rocks in. So I've had hand pain in my pinky and in my thumb. It's knocking out my shoulder, and it's also messing with my hip as well. So I've had a lot of knee pain because of it. So the hand is, um, I feel like, is just knocking out my whole side. And now the old ankle injury is starting to come back. So sometimes when I plant my foot, I feel like it shears. So yeah, and whenever I'm walking, I feel like I'm just kind of favoring the leg because I'm trying to prevent any knee pains from coming up. So yeah,
All right.
I feel like I'm kind of a mess right now.
Well, it's a good time to come in and get adjusted.
Yeah.
So,
And I feel like something I'm eating also is exacerbating the inflammation too. So there we go.
oh no. Hopefully it's not the ice cream.
No, I think it's Chipotle.
Oh, okay. All right, so here's what we're going to do. Take off your shoes, just slip them out of the way so that I don't step on them. And do you have anything in your
Nothing.
pockets? Okay, so
No belt.
start seated. So turn and face me, and you kind of know the drill, but I'm going to kind of talk you through everything, okay? So first, we just want to see how you are in a neutral kind of sitting position. So if you bring your arm out to the side, ready, resist, good. Are you switched? No, so that's good. Now go ahead, stand up. So let's see what happens when you stand, resist, good. Stand on one foot, either one. Do that again. Okay, and that puts you into weakness. So that tells us something's going on with your foot on that side. Stand on your other foot, and that one too. All right, so we have an instability through the whole thing. Now go ahead and sit back down for a second, because I just want to see if your body adapts quickly or slowly, and it adapts slowly. So you're still in weakness while you're sitting. There you go. So a few seconds, but the nervous system, as we both know, should be much faster than that. Go ahead, lie face up. So now we're going to see what happens to you when you're laying down. So standing, not so good. Sitting, you're okay. And laying down, let's see. Ready? Resist. Good. Does that switch you? No. Good. Any shock? Good. How's your diaphragm? Good. I check the emotional points. Always I just do those. So I'm gonna check you to see if you can walk. Okay? So bring this up and this up. So it's kind of a pseudo walking position, and so that works, but see, that does it. Yeah. So we're actually gonna start with your foot, okay?
Yeah, I get the SI pain back here.
Okay. So bring your foot.
Which I forgot to mention.
That's okay, I got it, because it's the whole side. And as you know, we have to check kind of all of the interferences that might be creating a problem here or here. And this is where your body's leading us to start here, okay? So it's kind of your foundation, even though we might think of the lumbar spine as the foundation. When you stand, right, you have a whole different foundation. So bring your foot up and in. Ready, resist. Good. Point down and in. And that's weak. So bring this up and out and down and out. Good. Okay, so you have your posterior tibialis. Point down and in again. Okay, so we're going to start with that. So I'm just going to unwind that and adjust the ankle to get that to start to firing correctly, okay? Do you want me to talk about what this is?
Mm-hmm.
So now we're using a percussor, which is an instrument that was developed by an osteopath named Dr. Fulford. And the percussor was originally designed to unwind connective tissue. So it's not really just like, people think it's like a massager, but it isn't, in the sense that it has two different vibrations that are happening in there. And it was designed, it actually goes fairly deep, and it was designed to work on the connective tissue. You okay, Patrick?
Yeah, it's great.
It's made my life really much easier, and I think the life of my patients much easier, because
Yeah.
otherwise I'd have to rub on a lot of points that I can just use the percussor with now, and
I love
I
this
kind
thing.
of use it as for multiple types of corrections.
I really like how there's no spasm in my muscles when you get the movement, the joint mobilizations.
Right.
It's very, very gentle on the body and very effective.
And you can see he has some fascial restrictions in his foot because there's no gliding. See, if I go down to right here at the ankle and I just glide over it, we hit a fascial restriction right there. But I'm actually starting up higher, and you see he's in all of his toes, he has some fascial restriction there. And so it just takes a minute. And you can feel this is unwinding. Actually, I can feel it changing his leg all the way up through his knee and into his SI joint and
My
into his
mid-back.
hip. Can you? Oh, you can feel it in your mid back.
Well, that's the vibration goes all the way up there.
Oh, good.
Yeah.
These points are acupuncture points in between all the toes that are commonly known as gate points. And if you just worked on those, you could change a lot in your body. So now I'm just kind of going up the muscle.
Can you tell us where all this is connected to beyond just the point that you're touching?
Well, it's the posterior tibialis, so this is your anterior tibialis. It's kind of like what you would think of as your shin splint, or your shin, really. It's where you posterior tibialis is the muscle that's kind of behind that one. So, and it runs down the whole side of the leg and attaches into the foot. So I'm just kind of following the muscle to make sure that it's free, because all muscles have receptors in the attachment, so in the tendons and in the belly of the muscle. And they could be not firing correctly, which will then change the signal going into the joints it attaches to, as well as then, in this case, into the lumbar spine. So we're looking at taking away as many aspects that might be interfering with the signaling going from his ankle, his foot, his leg into his spine. Now we can go, before we do anything else, we're going to go back and check to see if the muscle's now firing or not. So go ahead, point your toes down and in and resist. There you go. Good. Bring your foot up and in. Good. Down and out and up and out. Good. Now we want to know, so even though that's strong, we don't know if the joint's still in the right place. And so we're going to push on the joint and point down and in, and it's fine. So that's all corrected. So just unwinding it that way corrected a bunch of things here, and we go back and we want to know, did we make a change in how the body's functioning? Bring this up and this up. And it did, but now we can't just leave him there, because otherwise it'll now accentuate actually problems he has in his SI joint and his knee if we don't do anything else. So we're just going to kind of go up the leg, okay? So bend at the knee, keep your heel on the table, bring your foot up, bring it in, and resist. And that's the popliteus, so that's weak. That's a muscle that stabilizes the knee. It starts behind the knee and goes down to the foot. This side fires correctly. So we have a problem there. We're going to check his sartorius. Drop that down, pull in. Good, and that's firing. Let's just check both sides. We check that one. That comes down from the hip and inserts into the medial aspect of the knee, the inside part, and can play a big part in SI joint issues. So we're going to keep asking some more questions. And that's really kind of how I look at muscle testing is we're just asking questions about how his body's actually functioning. Good. Turn your toes out. I'm going to go this way. Ready, resist. Okay, so that's not quite right. Bend at the knee. Hold that there. You okay? Resist here. Okay, I'm going to push down this way. You resist. Okay.
What does that test?
Test the different aspect of the quad. Okay.
The extension aspect?
Yeah. So that's weak.
Here?
Here. So so it's really this, the lower portion.
Oh,
Okay, push up.
patellar portion.
Yeah, and see how so if we
Yeah.
were to fix the patella, that would fix that portion.
Interesting.
It didn't now. So he's just asking a question about that function. So resist here.
I've never felt that test before.
Yeah, so resist. So if we touch the belly,
I'm kidding. Okay, go ahead.
if the belly of the muscle,
Mhm.
nothing happens. So, but it's the lower,
Oh, it's the tendon.
yeah, it's the tendon. So we can also test it in a extended position. So if you hold the leg up, and that's fine. So different recruits in different ways. Did you follow all that? So we have some of the quads weak. We have the TFL is weak. So, not the TFL, the psoas, bend at the knee. Bring this in, hold that right there. Okay, and the piriformis is okay. So your psoas is a problem. I'm going to check the left, okay? Bring this straight up, turn your toes out. Hold that there, resist.
Oh my gosh.
Okay. So we have both psoas are weak. Touch right here, and that's an occiput issue. Yeah, right there. Okay. No, you have to touch there. Just touch there. Don't, yeah. Just keep your hand right there.
And the suture?
Yeah, right there. Okay. So turn your toes out. Ready, resist. Good. So that tells me that's where the problem is. Oh, we have another problem. Okay. We have two problems. Take that away. Touch this side. Okay, so we just went to the right side of the occiput. Good. Okay. So we know his occiput is having an issue, but I'm going to check something on his left foot. Bring this up, turn your toes out. Yeah, so he also has a problem in his left foot. We're going to fix that. We're going to fix your foot first, okay? So these are just patterns of problems that go with the weakness in the psoas. So now we're going to percuss his foot, the cuboid bone in particular, and adjust that. No wonder he's having problems.
A lot of foot pain recently too. In fact, both my feet were aching so bad last night that I couldn't go to sleep. I had to put the gel on them, finally went to sleep.
So you put something like Deep Blue on them?
Yeah, I put Deep Blue on them.
And it helped?
It helped me go to sleep, yeah. Yeah,
Okay.
actually it did.
It
did take
calmed
away
down
a
the
lot of pain.
achiness? Okay.
And I have used arnica on my hand, and that's surprisingly helped. I've never actually used arnica until now.
Oh my gosh, two of my favorite products, Deep Blue and Arnica. Should be in everybody's medicine cabinet.
Yeah, it's actually been very, very surprising.
Ah, there you go. Good.
I just
Yeah.
stopped tensing.
So yeah, so that let go. We're going to adjust it. I'm going to use the adjuster to do it because it doesn't need much. Okay. Now, we're just going to check your psoas again, even though it may or may not fire correctly because we have the occiput. Okay, so that fires. And that fires, and it does. So we'll get to his occiput separately, but we can go up and we can check. Doesn't always show up this way because it's a different issue, or it's just specific to those particular patterns. I'm just curious, okay? So here, you put your hand right there. Not too far back, Patrick, because you'll overshoot it and it won't, yeah. Okay, put that down because it's touch right there.
It's right on the suture.
Bring this up. Yeah, because it's a jamming.
Oh!
Yeah, it's a jamming of that suture.
Yeah, the OM.
So I take that away. I'm going to adjust this.
That's all SI and hamstrings.
So, okay. Touch that again. Yeah, touch right there. Good. Resist. Okay, so we still have something else. It's better, but you have something else going on over there.
It strains the vastus medialis.
No, you have something else still. Bend at the knee here, bring this in, hold that right there. Okay, put that down. Bring this one up, hold that right there. Okay, put that down. Push in here. Push in. Okay. Bring this up, turn your toes in, ready, resist. Okay. So now, so we have to fix, we're going to correct that, okay? So we're going to correct this, the tensor fasciae lata, but we're going to use the laser to help us. So we're going to multitask. And we're going to put this. So the laser is going to go in. I put it on a reflex associated with this particular muscle. There you go. Called a neurolymphatic reflex from applied kinesiology. And it has to do with that connection between the nervous system and the lymphatic system. And it's actually turning on that particular pathway. And he can feel it changing already. You can feel it, can't you? So now we can go and we can push in here. We can check some other things. So didn't fix the adductors. Bend at the knee, bring this in, push in. But it is help firing the piriformis. Now, just because it may be strong, we may have other things that we want to ask, is there anything else with that portion of the muscle? Yep. So I'm going to get in there and unwind it with the percussor. Wow, you really did do quite a number on yourself.
Oops, did I move it?
Nah. Remarkable.
It's kind of, it's just residual from doing all that really hard. Of course, I was in a completely flexed position doing a lot of the manual labor.
Is it done? Is the wall
Yeah,
done?
it's totally done. But I mean, it was hard work. Some of the flagstones I moved were huge. And it's just brought back all of my previously sort of, I guess, facilitated injuries. Yeah.
And again, where's this, once you loosen that, where all will that affect?
Well, once this gets loosened, this will affect his hip, his left hip specifically, his left hip down to his left knee, directly, and then it's going to affect his entire pelvis kind of indirectly, because if you balance out this side's going to also start to balance out. Nothing works individually. We look at, we break it down kind of individually, but it really doesn't work that way. You can't really have just an isolated issue of something not firing here and think that it's not going to affect anything else. Because everything else around it will then have to change what it's doing to keep his body and his system functioning the best that it can be.
So it's very interesting. It's like it's like I'm kind of residually compensating on one side to help the other, and I've done that a couple of times, at the very least in my lower extremities. But it's probably
Ooh. A little tender or ticklish?
Yeah, it's ticklish.
Yeah.
So it's probably being reflected from the upper body down here, which she's about to find out. So she's just kind of moving up the chain of compensation that I've gone through over these last couple of months. Ugh. And that just released my quadricep connection also with my IT band.
Oh.
It's ticklish. And and this is positively the releases are affecting my knee and my hip as well. So she's starting to release that compensation that was trying to that my right side was trying to correct.
Right.
So it's very interesting. So
the body will always try and correct itself. Unwinding his occiput. So
she finished the release in my leg that was before.
And we're going to go back and double check. So I just wanted to. So as we're releasing his legs and his ankles to stabilize his lumbar spine, I can see and feel the tension moving up into his thoracic spine. So he can feel it releasing through here. I can see it. I can see it. The tension building here.
Yeah.
So we have to keep on going. Now, not everybody might be aware that's happening as they're getting worked on, and that's okay too. They don't necessarily have to feel all of this. We've just been I've just been doing this a long time, and Patrick has too. And he's gotten a lot of work, so he's aware of how his body functions. But there's a lot of people that I might start working on at first that don't have that familiarity. That does not sound right. Doesn't have that body awareness, and that's okay. It doesn't matter. It's something that you can learn over time. So turn out. There you go. So see, it fixes, we corrected that muscle, bended the knee, bring this in, hold that right here. That's your piriformis. We corrected that. Push in here. We corrected his adductors. They're firing. Turn your toes out. And there's his psoas is firing. And no, he didn't grimace or anything. And I don't know if you could see that before, but anytime we tested that muscle, he would really grimace. So now we go back to here because there's still the unfinished piece. Now this is weak over here.
Same spot.
Right, and so we're going to figure out, so we can, so there. So a little bit lower than where you're feeling your trigger point, but we'll see how, this might also get rid of that trigger point. So we had to go right directly into that muscle. And what's interesting is if you're able to follow this, when we first tested that muscle, it was firing correctly. And it didn't show up with that weakness until we had done these other corrections. And that is very, very common in the body because, like I said, it's compensating, so it's turning things on or off to stabilize as much as it can with whatever it has to work with. And that's both the beauty and the bane of our nervous system. because things could be turning off and not working correctly and you not experience any pain. Or even be aware of any dysfunction. But it's happening, it's in there, and it's definitely happening. So, and that is one of the greatest opportunities of wellness care as well, is to be able to go in, get work done and see what's firing or not firing and have it corrected. So, oh, there we go. And you can feel the whole thing kind of calming down. And some rotation that was in his pelvis is actually leaving. So, and the beauty of also doing the muscle testing is that you can determine if you've completed the correction or not completed the correction. So if we bring his leg back up and we turn, we can see that it's strong, but we want to know if we touch the muscle, which is called therapy localization, if we touch it, it does fire. So there's no weaknesses, being that neurologically. Now, not from that muscle, Patrick. So is it better? Is that trigger point better that you were aware of? Yeah, so there's probably other things happening there. Let's go back and check the quad. Hold that right there, push here, good, push up here. And there's still some weakness there. Put your heel on the table, bring your foot up, bring it in, and we still have the popliteus weakness. Yeah, so I'm going to fix this tendon in the quad, so we're going to percuss that as well.
There's my knee sheared.
Probably, I don't really think of it like that.
It's getting it regardless.
Mm-hmm.
Oh, man.
And then just fixing the tendon.
Wow. That feels amazing.
There we go. Okay. Now we're going to have to adjust. We're going to adjust the fibula. So bring your foot up and in, and you can see that's weak. And if we challenge the fibula, he goes into strength. So put that down, leave that there. It just tells me that's gone posterior, so we're just going to tap that back into place. Bring this up and in. Good. Did we make that correction? Yes. So that correction corrects that popliteus muscle. Hold that there. Push up. Good. Okay.
Sorry, I got some cramp there.
Okay. Now bring this back up. Bend at the knee because it's not quite done. Ready, resist. See? So can you see how that went weak there as I touched that particular spot? So we, even though, see if we just test, push up in the clear without asking any other question, it appears that we've made the correction. But if we go back, so if we want to know here, that's fine. What about that there? That's fine. What about right there? Nope. So we just, and it's just a little bit, but that little bit could be like Chinese water torture. And it's still a weakness in the whole chain. And it just tells me that I didn't quite complete, maybe only 98% we completed the correction, not the complete 100%. So
So you can feel it when the fascia loosens or whatever it is?
most of the time I can feel it, you know, not maybe 95% of the time I can feel it.
Feel what?
So I feel the change in the tissue. So the tissues always have a particular feel when they're constricted or not moving, and then they feel a different way once they release. It's hard to really describe what that is. The person on the table can feel it too. Sometimes they can't describe it, especially if they don't have the awareness, the same level of body awareness that Patrick has. They'll just notice that there's been a change. And they might not be able to describe what that change is, but they felt something change. Because the vibration can be, it's really a lot of energy that goes into the body. And can take a minute, bend at the knee, to get used to. Push up here. There we go.
Yeah. Now I got my medialis firing.
There we go.
Strong.
So now, so I just checked the position of his hips and his pelvis, and that seems to be pretty good. Now we're going to turn him face down because I got to check his hamstrings, his glute max, and see what's happened to his sacrum and his lumbar spine from this. Okay, ready? Go ahead, turn face down. So oftentimes, depending on what's happening in the lumbar spine, the shoulders actually stop having their correct motion. So you would think it wouldn't be that way. You think they would oftentimes become hypermobile, but it's not true. They lock down if they're trying to stabilize the lower back, right? And so oftentimes there'll be pain either here. Any pain? Nope. How about here? No, so that's actually pretty good. We can also check the functioning of the neck to tell us where the lumbar spine and the sacrum is. So lift your head up and back and resist. Good. Turn your head to this side and resist. Good. Turn your head to this side and resist. Good. So those are all firing, which is good. Bend at the knee, we check the sacrum, put that down, bring this up. Good. Put that down. Bend at the knee, lift your leg up off the table, hold it up, resist. Good. Put that down. Bend at the knee. Hold it up. Resist. Good. Put that down. So those are both firing, which is really good. Bring this out to the side. Push up towards the ceiling. Good. That's firing. Push up towards the ceiling. Good. That's firing. Lift your shoulder up here. Ready. Resist. Good. Put that down. So that's firing. We could do the same thing on this side. Bring this straight up. Push up. Good. Bring it up this way. More. More. No, push up. So that's not firing. Bring this up here. Bring your shoulder up. Ready, resist. Okay, put that down. So now I want to see.
What did you learn by his shoulder up there?
Lower trap is not firing correctly. Okay, so the trap goes into, is divided into 3 sections. So we know, so it arises fascially, comes out of the lumbar part of the spine, goes up to here, gets innervated from T6. So it's just telling me some things that I need to look at for his spine, but we're going to challenge the position of his pelvis now. So he's going to bend at the knee, bring his leg up, hold that right there. So we're going to challenge it in pushing down the SI joint and the ischium, and those are both strong this way. We challenge it this way, and it's asking about a different part of the sacrum, and it goes weak here. So we're going to put his arms down by his side. I'm going to take the blocks, and so because of the way he went weak, tells me what position to put the blocks in. And it has to do with the motion of the anterior boot, which is the front part of the sacrum that's inside the pelvis that isn't quite moving correctly. So we're going to put him on blocks here. And we're going to put him on blocks here. Okay, so bend at the knee. We can go back, hold that there. We can challenge it, and he's now back in strength. So we're going to just leave him there. So now we can use any muscle to challenge the position of a joint in the body. So I'm going to use his mid-trap here. He's pushing up towards the ceiling. So I'm going to check the position of his occiput, which means that if I push on a joint, it should be able to respond without there being a problem. So it should not change how the body talks back to me, okay? So if I push on it, if it's in the right place and all the ligaments are where they're supposed to be and the facets are where they are and the joint position is correct, then pushing on it should be cause not a problem. Because that's what happens to you as you move throughout your day, right? You're walking and you're pushing on all of these joints throughout your body. And if they're operating correctly, it should be fine. So his muscle's strong here. If I push on his occiput, he's strong. If I push on it the other way, he's strong, he's strong. So I know that that's fine. We'll use his hamstring just because it's easier. If I push on this joint here, he goes into weakness. So we know there's a problem with how that part of his spine is operating right now. If we go up higher in the spine, bend at the knee, and we're talking, and I push on this joint, see, that's all, there's also a problem. So we know that he needs to be adjusted. If we, so if we use the percussor, we can speed things up a little bit. So I can use the percussor on the lower trap. I can use it directly on the vertebra to help them unwind. And just for, so if you percuss L3, that's going to do release the lumbars to a greater extent. And in the thoracics, I usually just ask which ones do we need to unwind. So let's just see, Patrick, bring this up. So we want to know, do we start with L3? Nah. Good. So I'm going to go up here to T12. We're gonna unwind that. And this usually, you okay? Usually happens pretty quickly. We can stop and we can check, bring this leg up, resist. So we still, all of this is weak. Put that down. So we're gonna go up here. Because remember, we're causing a chain reaction, just like all of his weakness is causing a chain reaction. There we go. Good. Bend at the knee. Good. And we can go back and we can check, and a lot of that's been corrected. So we still have a problem there. So this is still his lower trap. So I'm just put that down. So I'm going to unwind this portion of the muscle. There we go, and that lets go. That you feel it there? There we go. Bend at the knee, bring this up. Good, good. If we go along the muscle, it's good. We're going to test the muscle again and see how it actually works. Push up towards the ceiling. Good. And see, now he can even get his whole arm there, because before he couldn't even do it. Bend at the knee. Good. Good. Put that down. I'm going to take the blocks away. Now, Patrick, I want you to go ahead, sit up and face towards the desk. Face away from me. So, we covered...
a different world now.
Well, you kind of are. We've recreated your world, but there's still a few things left that we have to check, okay? So hold your arm out like this. Hold these two together. Ready, resist. Good. Give me this and this. Good. Curl your fingers in. Good. Make a fist. Bring it forward. Resist. Good. Bring it back. Good. Okay. Hold your arm out to the side.
With the fist?
Doesn't matter. Okay. We're going to challenge the wrist. So I'm going to push it together. It's fine. We're going to challenge the radius. It's fine. Here, here, but his clavicle. Not so happy. So we're just going to tap that into place.
That ties into the foot again.
So in his case, what we did also cleared his hand. I'm still going to tell him to use some more arnica or use some deep blue on his hands because that's actually going to help it tremendously. And I'm going to go up his spine and check all the vertebra. We're going to challenge it, so I'm just pushing on each one. Okay, so we're going to adjust in his mid-thoracics. Because remember, your spine changes position, whether you're face up, face down, sitting, standing, walking, or chewing, right?
So many.
So many. Those are kind of the basics, though. They'll cover a lot if we can get you strong in those. Good. And now he should be in pretty good shape. Because this was from work that he's done in the past month or two, we want him to come back ideally in the next week so we can recheck and make sure that everything we did held, and there still may be a little bit of cleanup that we need to do. Okay, so we want to make sure, resist, go ahead, stand up. Open your eyes, resist, good, stand on one foot. Resist, good. Stand on the other foot. Resist, good. So now, remember, if you remember, he wasn't able to do that when we first started. So now he's able to do that. This was quite a lot of work for one session, so we want to let that sit, but we definitely want him to come back.
Yay.
Do you have any comments, anything you'd like to say?
You know, I feel like I'm grounded in my lower body. I feel like my feet are connecting, and also my glutes are firing a lot better than when I came in. It was just really hard to get my footing, so to say.
Okay.
When I was the last couple of weeks, but this changes a lot of things. So yeah, it's nice. Thank you.
You're welcome.
And I'm out of it right now.
Yeah. Okay, good. Thank you.
It's nap time. Thank you. Thank you. Well, I'm finally getting my bearings back, but so I came in after doing a couple of months of hard manual labor using my hands, working with a lot of really heavy rocks, and doing all of that work in odd positions, crouching over, really bothered my hands. It brought back a lot of old injuries, and I was having a lot of foot and ankle pain, as well as my right knee was bothersome, and my hand has felt injured for a while as well. So it was really interesting. She did a bunch of muscle testing to see what was working and what was firing and whatnot on my body, to see what was functional and what wasn't, and started working on my feet. As she was working on my feet, she got the muscles and the joints firing properly, and then found out that some of the compensation of my right side was to prevent my left side from hurting itself. So it was very interesting. This is like when people talk about how humans favor a side. Well, it's favoring one side to prevent injury in the other, and I was doing that a couple of times stacked on each other. So she worked on my right side, got it functional, got it firing, and then found out my left side wasn't working properly, so some of the muscles weren't firing properly. She got those working, And then, once both of my legs were grounded and functional and the muscles and joints were firing properly, she started to gently adjust my spine and work up so that everything was kind of working and firing properly, and the muscles and joints were moving the ways they should, so as to not leave me in pain. And I feel very, very good after that. My feet feel more grounded. I'm not walking on like the sides of my feet anymore. I don't have any heel pain. My hand feels a lot looser. She really just did a very remarkable job. And the muscle testing mixed with the work that she does is extremely effective in diagnosing what's going on with me, as well as fixing what's going on. So highly recommend this.